So I'd like to switch to the second major concern, which is slightly more esoteric, but it involves how disabled people are viewed in society and the general negative valuation of disabled lives within Canadian society. Tough Rewind, who I understand is your next witness, notes that numerous reports in recent years have suggested that the lives of people with intellectual disabilities are valued less across society and that their short life expectancy results from inappropriate, value-laden decision-making by healthcare professionals. And there have been a number of studies that have shown preventable deaths have been caused generally by a failure to treat people with intellectual disabilities in the way they would others. There have been numerous studies around health attitudes in healthcare. Gill reviewed several studies to find there's a general negative valuation of disabled lives in healthcare settings, and in fact, in some circumstances, was more negative than in the general population. A recent study out of Harvard interviewed 714 practicing U.S. physicians and found that 82.4% felt that disabled people had significantly worse quality of life than non-disabled people. And they note that these findings about physicians' perceptions of this population raise questions about ensuring equitable care. Potentially biased views amongst physicians could contribute to persistent health disparities affecting people with disabilities. There are other disturbing examples of the intersection of health and disability. If we look at issues around prenatal testing and neonatal euthanasia, we find similar scenarios where it's poor quality of life for neonatal euthanasia. Significantly, people with spina bifida are euthanized as neonates. And the American College of Pediatricians notes that there's much room for parental, physician, personal, and social and economic bias in decisions around neonatal euthanasia. And it's not a stretch to think that similar considerations may influence the practice of MAID. In terms of ethics, we may think, well, the ethical systems will protect people with disabilities from undue access to MAID. In fact, we see streams of ethics, predominantly utilitarian streams, which is a major ethical system used in healthcare, are actually openly hostile to the interests of people with disabilities. This largely stems from a direct equating of disability with suffering. John Harris, a leading UK bioethicist, writes with regard to prenatal testing, where we know that a particular individual will be born deformed or disfigured, the powerful motive we had is to avoid bringing gratuitous suffering into the world. Will show us to do so would be wrong. He goes on to state that in the case of severe disability, we should give them a humane death by legalizing euthanasia in such cases. So I think it's important to note that he's not just arguing this is okay. He's arguing that we have a moral duty to eliminate disabled persons if they're presumed to be suffering. Free Winge notes the fact that disability itself, rather than an acquired medical condition, can be accepted as the cause of suffering justifies euthanasia is deeply worrying. There's inherent negative bias towards disability and disabled lives within healthcare and some ethical norms of systems. It's not difficult to imagine a scenario where disabled people are counseled or even encouraged to consider MAID. This is particularly concerning with regards to newly disabled persons or those experiencing prolonged mental health challenges. Not surprisingly, people who experience traumatic injury resulting in disability go through a period of despair and helplessness, but studies have consistently showing that over time they do adjust if they're provided with the appropriate mental health and disability-related supports. However, generally, this would be a period of years rather than months. So I think this all points to the risk that the mere 90-day waiting period suggested in the, or now in the new federal law, is far too short to avoid premature suicides in these cases.